In the interest of time, we have 3 of our 4 panelists, and one will be here shortly. I will introduce the 3, and then we'll ask you to begin, Dr. Ginsberg, and I will introduce Mr. Bachmann when he arrives. We're pleased that you were here with us this afternoon. Paul Ginsberg, President of the Center for Studying Health System Change, to be followed by Dr. Regina Hertzlinger, Professor of Business Administration at Harvard Business School. I'll jump over to Diane Archer, Director of the Healthcare Project, Institute for America's Future. And Dr. Ginsberg, you may begin your 5 minutes of testimony.
Thank you, Madam Chairman, Mr. Deal, and members of the subcommittee.
You might want to turn on your microphone and pull it a little close. There.
Sure, I got that. Appreciate the invitation to testify on price and quality transparency of healthcare services. In theory, more information on provider prices and quality can lead to lower prices and higher quality. Those consumers who choose differently will benefit, and if enough people make different choices, providers will be motivated to reduce their prices and increase their quality, extending the benefits beyond those acting on the information. But today, the reality does not line up well with the theory. Few consumers use such information to make choices. The tools to measure and communicate price and quality information are primitive at this point, and most consumers are not incentivized to consider price and not aware of the variation in quality among providers. Focusing first on price transparency, the key factor limiting the potential impact today is the lack of incentives in today's insurance benefit designs. There's little reward for choosing lower-priced providers, and this is even a problem in high-deductible plans with savings accounts. Much of the information that's available to consumers is not in forms that they can use. Hospital care is not priced in units that are meaningful to patients, such as per stay or per episode. Some information now provides ranges per episode, which is progress. The same issue with physicians. Fee levels do not provide insight into what services will be provided. And information that state governments and the federal government has provided are not reflective of people's health insurance. Also, there's a legitimate unwillingness by consumers to choose providers on the basis of price when they have little, if any, information on provider quality. There are some risks of unintended consequences of additional price information. For one, if the information discloses contracts between hospitals and insurers, this risks driving up prices. This is an accepted perspective in antitrust policy throughout the world that when markets are highly concentrated, disclosure often leads to higher prices. And another unintended consequence is that some consumers, particularly those who don't have incentives to look for lower prices, will use price as an indicator of quality and go to the higher priced providers. There are opportunities to do better. If we reform provider payments, this would create much more meaningful prices for consumers to respond to. Now, insurer high-performance networks can be seen as a first step in this direction, although success has been limited by the use of different measures by different insurers and lack of engagement of physician leaders. Information on charges by out-of-network providers and on what insurers pay for these services can be helpful. There are large differences in what the patient pays between in-network and out-of-network providers, and the database to be developed in the state of New York will support an important increase in transparency about out-of-network care. Now, quality transparency is much more challenging than price transparency. The measurement is very complex. Much of the measurement of quality these days is based on processes rather than outcomes because of such limited data on outcomes. And process measures of quality are inevitably going to be limited by our lack of knowledge about effectiveness. We need to know what processes really do improve outcomes. Providers are a key audience for quality information, so that even if consumers don't use it, there's a lot of potential with providers. They are highly responsive to quality measurements, and they take steps to improve quality, even if there's no pressure from consumers. And the example that Dr. Sigsbee on the first panel mentioned in his practice is a great example of the phenomenon. There are important roles for governments in advancing quality transparency in addition to the reporting that governments are doing now. They can convene provider leaders and insurers to agree on common measurements. This would enhance the credibility of measures to providers and also avoid excessive burden on providers from multiple reporting requirements. Sponsoring effectiveness research will strengthen the ability to assess quality. And there's potential for the private sector to analyze and communicate the public data, such as trusted not-for-profit organizations like Consumers Union or commercial data vendors like WebMD.
Yeah, I do.
In conclusion, transparency has the potential to increase the value from our underperforming healthcare system. The benefits are probably very small now, but there is potential to increase in the future. But we could lose in pursuing transparency by overselling its potential and deluding ourselves that other steps to increase the value in healthcare are not needed. Thank you very much.
Thank you. And now we turn to Regina, Dr. Hertzlinger.
Thanks so much, Madam Chairwoman, Ranking Member.
Is your microphone on?
Thanks so much, Madam Chairwoman, Ranking Member Deal. I'm used to screaming in a classroom, so I thought I was all right. I'm honored to be here. What does healthcare reform mean? Sure, most people want to buy reasonably priced health insurance policies, especially if they're threatened with unemployment, as sadly we are in this economy, but many people don't want government to control the process. So I think there's going to be a lot of wrangling as these two opposite points of view get sorted out. But there is a healthcare reform that can be much more readily implemented, and that is transparency. Everybody wants the government to help them make buying decisions by providing good information. They like SEC data about corporate financial performance, EPA data about cars pollution, and USDA and FDA data about whether our chuck roast is prime or choice grade, and the cleanliness of the supermarket. Expert, clear communicators help consumers interpret these sometimes arcane data, ranging from consumer reports for cars to media business gurus for stocks. When it comes to our troubled healthcare sector, Americans want government to provide information too. Why do we know more about the quality and prices of our chuck roasts and supermarkets than about our surgeons and the hospitals in which they practice? But Americans do not want the government to use these data to evaluate the cost effectiveness of products or to buy on their behalf. Franklin Delano Roosevelt, that great president, understood the distinction between government enabling information and government making decisions on our behalf when he opted for transparency to cure the stock market's collapse during the Depression. FDR was advised by his counselors that the government evaluate all securities. He rejected that advice. Instead, he created the Securities and Exchange Commission. He called it the Truth Agency. It was going to tell the truth about the corporate sector, to require corporations to disclose their results using GAAP, which were audited by independent certified public accountants. The SEC was armed with hefty enforcement power. The SEC has been a miserable failure in its regulatory function, but extensive academic research demonstrates how successful its truth-telling mission has been. Transparency has lowered the cost of capital because when investors are uncertain about performance, they require higher returns. Transparency helped protect against misappropriation of shareholder returns by managers. You see it right now with the current outcry against CEO compensation. Most importantly, it enabled appropriate allocation of our resources. Investors reward productive, socially responsive firms more than others. In contrast, we know virtually nothing about the quality and cost of medical providers or about the performance of our hospitals and our insurance. Transparency would enable a woman who's contemplating mastectomy to know the death and disability rates of potential surgeons, infections, clots, medical errors like leaving a sponge, rates of readmission, infection rates, and the prices they charge for similar kinds of patients. Transparency would also enable consumers to better evaluate their insurance firms through information, for example, about the number and types of complaints the firms receive from irate customers or medical care providers and their responsiveness to them. This kind of transparency will enable properly informed consumers to reform healthcare by selecting the providers and insurers that give them the best value for the money. Some contend that transparency leads to price collusion. If this were true, every yogurt on your supermarket shelf would bear the same price. It doesn't, because the yogurt industry is highly competitive. Collusion is possible only in highly concentrated oligopolistic markets. Transparency facilitates the government's prosecuting price-fixing competitors in these industries. You are all too young to remember the NASDAQ scandal where dealers rounded up to the nearest eighth of a penny. The reason that we know about that scandal is that information was transparent and academic researchers found the collusion. It led to a $1 billion payout by the colluding oligopolistic securities firms. Voluntary disclosure does not work. How do I know that? We have no information. As demonstrated elsewhere in our economy, transparency through a truth agency will go a long way to reforming healthcare. Representative Deal's bill captures the essence of what this kind of health reform is all about. Thank you.
Thank you very much, and I would like to welcome to the panel Mr. Bachmann, Ronald Bachmann, Senior Fellow at the Center for Health Transformation. You are recognized for 5 minutes, please.
Thank you. Yes. I'm Ron Bachmann, Senior Fellow at the Center for Health Transformation, and my mission in life is to solve the uninsured problem. And so the transparency issue before us today is very much a part of that, in my opinion. Transparency means the public disclosure of honest, meaningful decision-making information. Clearly, the public has a right to know key information to maintain their health and safety. When up to 98,000 patients die each year from hospital errors, citizens have a right to know where these are occurring. When now 9,000 deaths occur from medication errors each year, the public has a right to know the facts. When hospital-created complications and provider-induced viruses are more deadly than the original medical condition, patients have a right to know. The best way for the public to change poor business behaviors is to improve quality and lower costs is for the guilty businesses to lose customers. Unfortunately, in healthcare, the consumer is rarely the customer. The consumer is one who uses the service. The customer is the one who buys the service and pays the invoice. In healthcare, the customer is usually the third-party payer, the insurance company, the HMO, or the group plan. New generation health plans are financially empowering health consumers and transforming them into health customers. To become an effective health customer, one has to have both a financial stake in purchasing and the information to make informed decisions. You cannot have a quality health care in any system without both. Financially empowering plans with savings options increased 5% in 2007 and 8% in 2008. Employers with 3 to 200 workers are the fastest growing group, up 13%. With account-based plans, individual worker premiums are 40% less than other plans. Family premiums are 30% lower. The average employer account funding is over $800 for an individual and over $1,500 for family coverage each year. In 2008, 71% of employers offered incentives for health and wellness or disease management programs, up from 62% in 2007. The incentives averaged $192 per person per year. Account-based plans are not just for the healthy and wealthy. In 2009, young families 25 to 40 had balances averaging over $7,000 in these accounts. By the end of 2008, the average savings accounts total over $8,000 for individuals and over $10,000 for families. The newest products are developing more information to help individuals make informed choices with those dollars. Historically, transparent cost and quality information has been hard for plans and the public to access. Providers have maintained the argument of confidentiality, proprietary needs, and competitive advantage. With empowered individuals, these arguments rapidly dissipate. National insurers, some providers, specialty vendors, and state governments have been taking the lead in requiring disclosure of provider cost and quality information. Each insurer or hospital has limited data. States differ on their reporting requirements. Budgets limit the expansion of publicly funded information access, and inertia of the status quo slows progress in meeting patient information needs. The federal government can advance the cause of empowering individuals with information by passing basic national standards for provider and insurer transparency. Congressman Nathan Deal's legislation is on the right path. A governor of Georgia once said that to have better prisons, we needed better prisoners. Today, that parallel may be to have better health and at lower costs, we need better patients. The CDC tells us that behaviors determine 50% of health. By far, the individual turns out to be the most important variable in the healthcare cost equation. It's not doctors, hospitals, pharmaceuticals, or other care providers. Access to care has only a 10% impact on health status. Genetics 20%, environment 20% make up the remaining factors. Congress is a powerful legislative body, but you cannot change the laws of human nature. You cannot make recalcitrant patients take medications or comply with physician orders. You cannot make citizens eat properly, exercise regularly, or seek preventive care. The bottom line is you cannot legislate personal responsibility. Congress can, however, create an open, transparent, information-rich environment that supports greater engagement by individuals in their own health and health care decisions. In general, individuals will not take care of themselves just for the sake of good health. If that were true, we would not see the rampant growth in obesity and epidemic of diabetes. We are typically American. We want to be paid to do the right thing. We want incentives, rewards, and recognition. We want some financial control, and we need information and help with making the right decisions. Blue Cross Blue Shield studies show that patients with financial and information support have more than 3 times the number of members engaged in smoking cessation, more than 3 times the number of members engaged in stress management programs, more than double the number in diet and nutrition education programs, and nearly 2.5 times more likely for those patients to be in exercise plans. A major interest in Congressman Deal's legislation is disclosure of self-pay charges. When I started to negotiate provider network reimbursements back in the early 1990s, the expected discount from hospital charge masters, their so-called retail price, was typically 5 to 15%. The discount game has led to artificially high retail price lists where discounts are now 80 to 90% off of those charges. No one pays the retail prices except the uninsured. Those most vulnerable and least able to pay are charged the list rates. Many who cannot or do not pay these artificial charges are hounded by collection agencies for monies that are 10 times or more above the cost of actually providing the services. As with the Georgia governor's call for better prisoners, it's time to free consumers from the dark prison of ignorance. You can make information easier to find and easier to understand. You can eliminate arbitrary price discrimination against the uninsured. The need is to pull back the curtain of secrecy on cost and quality. Congress can make a difference in saving lives and saving money by supporting the individual's right to know. While the country debates reform of health care, on one fact you should all agree: the need for transparency is critical to the outcome in that debate.
Thank you, Mr. Bachmann. And now we turn to Diane Archer for 5 minutes, please.
Madam Chairwoman, Mr. Deal, thank you for inviting me to testify about transparency in the private health insurance system and how it can help American families. At the Institute for America's Future, we've studied the issue extensively and concluded that the private health care system will never work well for American families without significant changes in the current disclosure practices of the private insurance industry. Here's why. If you wanted to buy a car, you'd have a vast array of public information about differences among them, from fuel efficiency to annual maintenance costs to crash test performance. But what can you find out about the various makes and models of private health plans? Practically nothing, it turns out. So what is the value of having so many choices? Even the most sophisticated among us have little idea what we're paying for when we buy insurance. Does it cover tamoxifen if I'm at risk for breast cancer? How much is the average out-of-pocket cost for typical prenatal care? What percentage of total claims were denied last year? What will a particular service cost me? Private insurers, in sharp contrast to the public Medicare plan, have been able to keep confidential claims, cost, and quality data on the ground their business trade secrets. We can't find out what specific services will be covered and when, or average out-of-pocket costs for typical conditions, let alone which insurers deliver the best value for our premium dollars. Informed consumer choice is a myth. To build an efficient healthcare system, we need insurance company performance information. I've spent the last 20 years helping people navigate both Medicare and private insurance for a long time as president of the Medicare Rights Center. I want to take you briefly through the structural issues that may preclude needed transparency from the private insurance industry, the data we need from private insurers, and how healthcare reform can address these issues. In America today, people can't compare health plans based on value. The health insurance market is broken. In a competitive market, insurers would be marketing to healthcare users, demonstrating why they deliver the best value healthcare for people with cancer, diabetes, and heart disease. Their message would appeal to the 20% of the population who consume 80% of healthcare dollars. Instead, if they deliver great care to people with costly needs, they don't want people to know. 12 years ago, in a New York Times Magazine cover story that I keep by my side, Helen Darling, now president of the National Business Group on Health, made this point very succinctly. Quote, "I've been sworn to secrecy by one plan that has the best AIDS program in the world. They don't want people knowing about it. They couldn't handle the results. Ideally, if we lived in a wonderful world, we would want a plan to win prizes for their wonderful care. But in reality, that would kill them. To maximize their profits, health plans compete for enrollees least likely to use their product. Therefore, health plans do not advertise the specific treatments and tests covered, the conditions under which they are covered, or the price of services. This is precisely the information we need to know. Different private plans offer different value health care. The best of them help ensure doctors deliver good care, yet coverage decisions are largely considered proprietary and unknown. And we don't know whether insurers are adding value or simply increasing their profits. A New York State Medical Society survey revealed that 90% of doctors said they have had to change the way they treat patients based on restrictions from an insurance company, and 92% said insurance company incentives and disincentives regarding treatment protocols, quote, may not be in the best interest of patients. Are insurers spending our premium dollars wisely? Are they helping to ensure that our doctors provide us reasonable and necessary care? We don't know. What data is needed to evaluate health plans and help people make informed health care choices? The kind of data we get from the public Medicare plan, the specific services they cover and the amounts they pay, claims data and denial rates. Members and prospective members also need to know the average out-of-pocket costs for treating different conditions. This data will help give us meaningful choice, and over time will help us in efforts to compare health outcomes for people with different conditions in different health plans. As important, disclosure of this data would promote better insurer behavior. Right now, the countless reports of insurer abuses suggest that the lack of transparency allows insurers to delay and deny care and reimburse inadequately for services rendered, seemingly arbitrarily. Up until now, we have bought into an opaque and inefficient private health insurance model that has not met our health care needs. Regulations will never address the insurer's obligation to put profits first, but we can drive accountability if we require far greater transparency from the insurers. A public health insurance option is also essential. A public health insurance option sets a benchmark for coverage, drives competition among insurers to rein in costs, and through its willingness and ability to be transparent and accountable, can promote the value and system-wide change that is needed to guarantee everyone in America quality, affordable health care. Thank you.